Welcome. Let's talk today about the reliability associated with using simulation for assessment. My name is Dr. Paul Frampus. I'm the director of the Winter Institute for Simulation, Education, and Research at the University of Pittsburgh. Many of you know us as WISER. Whether it's performance assessment to give feedback to learners or part of a research project, a simulation task training attempting to analyze tasks or skills, think suturing or something, or teamwork and communications, reliability is an important factor. Today we're going to talk specifically about inter-rater reliability. What is inter-rater reliability? Well, I'm glad you asked. The simplest way to describe it is achieving a similar score from multiple raters observing the same simulation. Why is inter-rater reliability, or IRR, absolutely essential? Because without consistent and reliable scoring across multiple raters, the validity of any assessment, especially medium or high stakes ones, can be questioned. Inter-rater reliability ensures fairness, objectivity, and most importantly, the most accurate reflection or scoring of a participant's performance. But let's be honest, achieving high inter-rater reliability in simulation-based assessments isn't easy. It comes with careful planning. Scenarios in healthcare simulation are often complex, dynamic, multifaceted, and worse yet, may not have been designed with assessment in mind. The assessment tools that we deploy may not be optimized, and the raters might not be fully calibrated to do their job. Where does one begin with struggling to improve inter-rater reliability associated with assessment? Well, sit back and relax, because that's where the RST approach comes in, focusing on the rater, the simulation, and the tool. The RST model is a framework for you to consider when thinking about the major variables that you have control over with regard to designing and conducting simulations for assessment purposes. I want to try to give you a somewhat abstract concept to grab on. Imagine a camera tripod. Think if you had a level across the top of it, and when all the axes were level and perfect, that would represent perfect inter-rater reliability. If the level measurement was off in a certain direction, you could change one of the legs of the tripod toward perfection. That is exactly what we are suggesting for this concept. Think of the legs as variables in the equation to manipulate or modify to achieve the balance. The metaphorical three legs represent RST, or raters, the simulation, and the tool. In this video, I'll explain the RST framework and give you practical strategies for improving the inter-rater reliability in your simulation assessments. Let's start with R. Let's start with the rater. Raters bring their own experiences, biases, and perspectives to the table. They can influence scoring. So how can we reduce this variability? Rater calibration sessions. Consider holding rater calibration sessions. This involves reviewing sample performances together and discussing scoring criteria as a group. This helps align everyone's understanding of what the assessment is measuring. Next, maybe look at rater selection and experience. Choose the right raters. Are they subject matter experts? Do they need to be? What do you need them to rate? Do they have training and assessment, or at least in the assessment tool that you are using? Experienced and knowledgeable raters reduce variability and can help to increase reliability. Addressing bias. Tackle biases head on. Train your raters to recognize and mitigate biases, like favoring individuals whose practice style resemble their own. Using multiple raters and averaging the scores is another way to minimize the impact of any one person's bias. Then we need to move to replacing outliers. If a specific rater consistently shows scoring discrepancies, it might be time to reassess their role or limit their involvement in high-stakes assessments. By focusing on calibration of the raters, you're setting the foundation for consistent evaluations. Now on to the S. Let's talk about the simulation. Designing your scenarios to make key behaviors and decisions observable can significantly improve your inter-rater reliability. Consider changing the design of your scenario to make items or thought processes more observable. Think about observable actions. Encourage participants to verbalize their thought processes. For example, in a critical diagnosis scenario, ask them to think out loud, or better yet, Have them give report off to another receiving colleague so that they have to interpret their clinical findings and put them on display for your assessment. Build in structured checkpoints where participants summarize their findings or outline next steps. This gives raters clear moments to assess what's going on and the thought processes behind the decisions. Standardize the simulation flow. Use standardized patient scripts or consistent cues and fixed timings for critical events. This ensures all participants face the same conditions, improving comparability from one simulation to the next. Simplify the complexity of your scenarios. And finally, don't let excessive realism overwhelm your raters or the learners. Simplifying scenarios to focus on specific competencies makes scoring much more reliable. Finally, consider the equipment used to achieve the scoring observations. If a post-simulation video is going to be used to score the event, ask yourself, do I need to add a camera? Do I need to change a camera angle to gain a better perspective on the simulation? Remember, well-structured simulations and simulation scenarios designed with assessment in mind lead to more reliable evaluations. And finally, the T. The third piece of the puzzle is the tool. A clear, intuitive assessment tool helps raters interpret criteria consistently and apply them accurately. Consider using behavioral anchors for your rating scales. Instead of vague terms like good, average, and poor, provide specific examples like effectively communicates diagnosis and treatment plan. Group items on the assessment tool logically. Group similar items together like communications, decision-making skills, and procedural skills so raters can focus on one domain at a time. Simplify the language. Keep the language straightforward and free of jargon. If raters struggle to interpret the tool, their scoring will suffer. Enhance usability. Small tweaks like improving font size or organizing the layout can reduce rater fatigue and scoring errors that come from it. Limit the overall number of items to be scored to allow the rater to focus on what is truly important. Too often, I see attempts at scoring tools that try to score everything in the world on one page. That is sure to cut into your reliability, mainly if your assessment is occurring while the simulation is running in real time. Lastly, some other nuances about the scoring tool to consider include whether you're using pen and paper or some sort of electronic scoring tool on a computer or perhaps a tablet. The advantage of electronic tools is they can be dynamic, reorganize the screen to help the rater. For example, items scored may disappear from the screen, leaving the screen real estate for the remaining items. Or scenarios that are scored in specific phases, perhaps before and after a cardiac arrest, for example, may occur and benefit from being on separate electronic screens. Lastly, with regard to the tool, you would do well to pre-test it. Get feedback to identify issues and refine it for maximum clarity and reliability. An optimized tool can make all of the difference for your assessments and ability to achieve good inter-rater reliability. Now let's see how the RST approach works in action. Imagine you're running a simulation to assess participants managing a cardiac arrest scenario. First, you hold a calibration session for your raters to agree on scoring criteria and familiarization with the assessment tool and equipment. Second, you adjust the scenario to include structured moments where participants explain their reasoning for medication choices with standardized cues for every participant. Think, for example, about a handoff conversation from the emergency department to the ICU. Third, you revise your assessment tool with clear behavior anchors like administers epinephrine within 3 minutes and group items logically under the headings like clinical judgment, communications, and so on. Lastly, go back and eliminate redundant scoring items or those items that are truly not the focus of the assessment or items that you find that you just cannot get good inter-rater reliability on. Through this process, raters now have a shared understanding of participant actions that are more observable and tools that provide clearer guidance and ease of use. The result? Higher inter-rater reliability and more valid assessments. Improving inter-rater reliability in simulation-based assessments is no small task, but the RST approach gives you a framework to tackle it. By focusing on the rater, the simulation, and the tool as the variables under your control, you can construct a situation to ensure consistent, fair, and accurate evaluations, ultimately creating higher quality assessments. Ready to elevate your assessments? Let's go. Hey, if you like this content, like, comment, and subscribe. If you want more content like this, give us a shout. And remember, happy simulating.